Good evening, everybody. As I promised, that we will definitely come back soon with our new webinar series in the month of July. And today, I am really happy to introduce you Dr. Sayan Dey from Bhutan. He is a lecturer in postgraduate department of English, Yonphula Centenary College, Royal University of Bhutan. He is also a brilliant scholar in the field of English and senior advisor in the Quality Education Program, Center for Regional Research and Sustainability Studies in India. And today's topic is very openness. That is very important and real challenge for upcoming days after COVID scenario will be over, and how to embrace the abnormal in the post-COVID era. And it's very privilege for us to hear Dr. Sayan Dey for today's webinar series in the month of July. And I'm as a host for Web Platform for Dialogue. I welcome you, sir, for today's webinar series, and I hand over the session to you. And I request all the participants to please raise your question. You can write in the chat box, or else if you have to direct interact with Dr. Dey, just wait for finishing his lecture, and afterwards I will definitely give you the chance to talk. So I welcome you, sir, for today's webinar series.
Thank you so much, ma'am, for your warm invitation, and also I am extremely excited to be a part of this series because I have been following the website, the previous reflections that have taken place over various perspectives uh, associated with COVID, post-COVID, and so many other dimensions that have already taken place. And I'm really happy today to be here to share some of my thoughts. And so, what I'm going to do is basically, I'm not going to deliver a lecture, and I'm not going to do a kind of usual, the usual way of presentation. So, to make it in a discursive tone, I'm going to share some of my thoughts. More than thoughts, I must say some of my real concerns, which I have been grappling with. So this is why I have titled my concerns, my reflections as embracing the abnormal in the post-COVID era. Now, obviously, um, those who are here, you must be wondering that why I'm going to talk about abnormality, or rather, what I'm going to talk about abnormality. I mean, this is a question that I'm asking to my own self as well. So basically, with respect to this particular topic, I have thought of dividing this lecture into three parts. First element is in part one, I'm going to, and you will see all the three parts are framed in terms of questions rather than statements, because today my reflections will raise more questions and less answers, and which I think is very important because every question cannot have an answer, and we can already see to that. COVID-19, this pandemic of COVID-19 has consistently reminded us that we cannot answer every question, respect to whatever perspective it is. So, in the first part of my reflection, what I'm going to talk about is that what is normality all about? What is abnormality? And can it ever be concretely defined? Or anyway, I mean, concretely, abstractly, can it be defined at all? These notions of normality, abnormality, with respect to various perspectives we talk about. Number two is in continuation with my part one, that we have been talking a lot about that, through Facebook, through WhatsApp, and through various other social networking sites, Instagram and all. This day in 2019, I went with my family to that particular place. This day in 2019, I was with my lover or my husband or wife, or with somebody close to with my group of friends to this particular place. What a beautiful life it was. I wish things go back to normal. But trying to understand this notion of normality as holistically, as inclusively as possible, the question that comes in my mind, that was really anything normal in the pre-COVID era? And with respect to that question, number three, why do I argue or why do I propose that it is very important for us to embrace the abnormal? So obviously now to come to the question of why to disown normality, why to embrace normality, the first and the foremost thing is what is normality, what is abnormality. And obviously, as I said you at the very outset, I cannot give you any concrete definition. I don't know what is being normal. I don't know what is being abnormal. Because usually, and whenever I think about these notions of normality and abnormality with respect to various perspectives, with respect to my personal socio-cultural political existence, with respect to my geographical positionality, with respect to my racial positionality, with respect to my psychological condition, which obviously changes from time to time, with respect to my physical condition, which is obviously it is not static, it is again changing from time to time, my notions of being normal and being abnormal also transforms from time to time. And it is not the question of whether my notion of normality is right or your notion of normality is right. The question is not about whether my notion of normality, my abnormality is right, or your notion of abnormality is right. What is important before we find answers to problems, what is important for us is to ask the right questions. Which are the right questions? Right questions means, again, I'm not positioning this notion of the right question against the wrong question. I'm saying right question means the questions that are relevant in the present context, and obviously in the present pandemic context, in the present social context, and everything. Now, usually when we see or when we engage with this notion of normality and abnormality, what we usually see is that we talk from our respective positions. Now, for a financially privileged person like me, for me, a normality is, at this time of the year, I am supposed to have a summer vacation at my college in Bhutan. I am supposed to go for a 2 weeks break at my home to meet my friends, to meet my family, my parents, my siblings, and everybody. And after a 2 weeks of enjoyment, I should come back. But unfortunately, because of the lockdown, I could not go. So my normality was disrupted. Now, just imagine a normality for a person who doesn't have a house, who doesn't have a salary, who has lost his job, his or her job, which is happening very frequently, or is not getting properly paid, or is underpaid. Will this normality of mine will be the same for the person of that particular scenario, of that particular situation? Obviously not. So this notion of being normal, the notion of being abnormal, we have to understand from our respective positionalities. But unfortunately, what happens in our daily life, even prior to the pre-COVID era, I'm even keeping aside this, COVID element, even if I keep this COVID element aside, and if I engage with this notion of normality and abnormality, or being normal or being abnormal, we see that what happens, only certain privileged, the notions of normalization or being abnormal, that emerges out of certain privileged voices who are socially, culturally, economically, politically, racially, communally, religiously, geographically privileged. It is only those voices of normality that gets globally analyzed. So for me, for a person, normal life is all about, enjoying a summer vacation. Normal life is generalized as enjoying, a time with the family members. Normal life is going for a trip to the US or a Thailand, or to, to somewhere in Indonesia or in the Europe in the summer vacation. So a normal life is interpreted as a form of a very privileged way of existence. Now, this privileged way of existence, which has been disrupted by this COVID-19, no matter, irrespective of one's economic, social, political scenario, each and every person in this world has been impacted, if not physically, but obviously psychologically, by this COVID-19 thing. So what is happening is This normalization, this very capitalistic notion, capitalistic privileged notion of normalization that we have been engaging with to date, has been put into a big question mark. So obviously this is normal. Anything exists outside this circle, outside this privileged capitalistic circle of normalization, till date have been required as abnormal. So no one really thinks about that what is the normal for a person who stays in the street. How many of us think about that what is the normal of a person who stays in a in a slum area? Since the outbreak of COVID-19 in India, we have been seeing one thing, that how the newspapers have been projecting the slum areas as that they are so underdeveloped. The slum people are not maintaining social distancing. They are unaware souls. They don't have sense of hygiene. They don't have sense of sense of fellow feeling that they should maintain social distancing. Now let us come to the practical part. Do you think, let us just apply a common sense, let us keep aside all theories and philosophy aside for one day, and let us just apply a common sense and think that if I am in a position, if I have to stay in the slum, am I going to stay out of my own urge? That okay, great, I want to go and stay in the slum, leave my house and stay in the slum. Obviously not. Situations, economic, social, cultural, political, and several other factors will compel me to stay in the slum. So the slums that exist only kind of exposes the economic vacuum of a particular social structure, or widely of a particular country. So how do I expect that the normal way of lifestyle in a slum will be full of social distancing? How do I expect that the normal way of slum, where all the people have to stay with each other, where the places are absolutely dirty, where people have no access to clean water, people have no access to clean toilets, how do we expect that the people in the slums are going to stay or maintain the basic hygiene? If I am hungry right now, the simple thing is, if I am hungry right now and I don't have money in my pocket, I won't care about hygiene, I won't care about ethics, I won't care about moralities. I will go to any extent to feed my stomach right now. Now, today I am sitting in this privileged space, and it's very difficult to, it's very easy, actually, not difficult. It's very easy to, argue about, you see, this is what is normal and what the slum people are doing. They are absolutely ignorant. These people are absolutely abnormal. It's very easy to see. But if we position ourselves physically, if we experience the enigma, the kind of crisis that they face on a regular basis, then only, these elements, these ideologies that we engage with, that this is normal, this is abnormal, puts under question mark. And having provided this background, there are certain constructions of normality and abnormality which are based on definite hierarchies that are generated from certain privileged positions, which I have already mentioned. And those hierarchies of normality and abnormality actually leads to these, what I have identified, these kind of constructions. Those parameters, systematization, the naturalization of these hierarchies, those capitalistic, Western privileged, elitist hierarchies that exist. So first is obviously the physical construction, and which I have already briefly talked about. So today, a person who earns a lot, who can stay in a 3-story building, who can stay inside the complex, who has all the access to all the basic necessities of life because he or she is able to afford. Obviously, for that person, normality is wearing a mask. For that person, normality can be, washing the hands with soaps and sanitizers. For that person, normality can be to maintain physical distance, from his or her wife and husband and children, because they have enough rooms to stay. They can maintain physical distancing. But this is not a normality for a person who stays in the street, who stays in a shack, who doesn't have money to feed his family, his or her family. So, these physical constructions, but what comes to the forefront? Which narrative comes to the forefront? You see, this is the normal, this is the abnormal. That normality is where people are socially distancing themselves. Okay, they are normal, but these people who are not socially distancing themselves, they are basically abnormal. These people are out of their mind. But how many of us, yes, there are people who are deliberately disowning the norms, disobeying the norms. That's a different story. I'm not talking about that. What I'm talking about, that how many of us go beyond this, parameter, go beyond this layer of what we visually perceive and try to understand the true story behind each and every activities, physical constructions. And then comes with the psychological constructions. This particular class of people, they are sensible. This particular class of people, they are not sensible. Sensibility, even the notion of sensibility comes with the element. It is so, we are so much eaten away by the, corroded away by these, toxins of capitalism, that these psychological constructions, we are so psychology that, a high class people, elitist class of people, money minded class of people, they are normal, they are, maintaining the hygiene. But these people who stays in the slums or in the roads, they are absolutely rubbish people. They are psychologically backward, they are abnormal. Then you have public constructions. In a similar way, when we push ahead with this notion of normality and the abnormality, you see how, public is constructing being normal and being abnormal. And those constructions are coming up with communal divisions. So you see, you have narratives through videos, through false audios, through false propagandist messages, that where a certain religious groups are said, oh, they are abnormal, they don't follow the norms, they are not cultured, etc. And a certain, at the cost of a certain religious group who are very normal, they are abiding by the rules and regulations, etc. And we see every day it is in, being projected in the newspapers as well, where, this comes through the Hindu Muslim clashes, this comes to the Christian Muslim clashes, Hindu Christian clashes, and so on and so forth. With respect to marriages, with respect to public gatherings, with respect to religious gatherings, every day, each and every day, false narratives are being generated. And we know what happened, basically with and after the Nizamuddin Markaz incident. Obviously, gathering at the time of, any kind of pandemic crisis is never accepted, whoever does it, whether in terms of gender, in terms of religion. But let us see what follows after. What kind of narratives come to the forefront? False videos, Muslim man spitting on the vegetables, Muslim man spitting on the, fruits prior to selling it to the people in order to spread coronavirus. Later on it comes, it's a false video. It was not about, it has nothing to do with coronavirus. Muslim men, after, prior to serving food to the people, they are licking the plates. But later on it comes that they are not licking the plates prior to serving the food. After having their lunch, they are finishing up their plates. So, these kind of constructions that keep on taking place just to, continue with this notion of being normal and being abnormal, which has been existing from the pre-COVID era. And then obviously you see the private constructions as well. And, at homes, people are being brainwashed that don't go to that person's particular house. That person can be a Muslim, and a Muslim person is supposed to be, infected with coronavirus, is synonymous to COVID-19. We are now very much familiar with the, terminologies like COVID jihad. It was there right in the tutor. So we see, this private constructions, public constructions, psychological constructions, physical constructions through the media, through the social networking sites, through the, the kind of brainwashing that is being done in a private family space. Altogether, what has done is put these notions of normality and abnormality in the question. Now, having said that, I will just move to the second part of my presentation or reflection. These perspectives, these experiences, actually kind of make me feel that was really everything really everything normal in the pre-COVID era? Is everything normal in the pre-COVID era? Now, having said that, having dig in with these notions of normality and abnormality, if we sit now within our respective economic, geographical, racial, cultural, communal positions in our respective places, now if we reflect back that even in the pre-COVID era, was everything normal? It is very problematic for me to call everything normal, because usually we see, at least when we interact with each other, what is our notion of normality? The usual, as I said, it is very difficult to define, and I'm also not trying to define at all. But what I'm trying to do is trying to problematize it. And how do I problematize it? Through these particular points that are right in front of you, which I'm going to briefly talk about. But usually when we talk about normality, we kind of construct a very utopic world and utopic image in front of us. Everything is balanced, everything is beautiful, physically beautiful, psychologically beautiful. There is no conflict, there is no crisis. So in a nutshell, our notion of normality is actually a weapon to escape from the realities of existence. And we have so many tools to escape from the realities of existence. For example, even today, when you hear about COVID deaths and all, people don't want to think about, people don't want to feel that pain, that crisis, that if somebody has died, we should try to understand the crisis, the kind of, lackness, the kind of backlogs that exist in a country. Rather, it is very easy to say, oh, this person might have committed some sin in the previous birth, so that person has died in the present birth. If a Dalit dies with respect to because of COVID-19, it's very normal. A Dalit is, according to the Hindu scriptures, a Dalit is, born to be punished, born to suffer. He or she is an outcast if it's born in the Dalit caste. So that's fine, no problem. If a black person dies in COVID-19, that's perfectly fine. Blacks are supposed to suffer. Blacks are supposed to be dehumanized. Our history has said, the white European colonial history has taught us that being a non-black is always superior to being a black. Now, if someone dies in a village, in a backward rural area, and backward in the sense I'm saying is in terms of infrastructural backwardness, not in any other sense. So in a backward rural area, if a person dies, that's quite normal. Rural people are not expected to receive anything. They are born to suffer, to work hard. Only they will work hard, and the privileged people will reap fruit from it. That's it. That's it. Nothing else. So, these kind of things. So through these kind of escapist remarks, through these tools of escapism, we actually try to construct our normality. And that is what we have been doing, since the pre-COVID era. It is nothing new in the COVID era. Now, what is happening is this notion of normality, this COVID-19 is consistently exposing the skeletons further, is consistently drawing our attention that you see, nothing was normal in the pre-COVID era. What you refer to as normal was only meant for certain privileged classes of people. Actually, if we have to decide between normal and abnormal, several things were abnormal in the pre-COVID era. So, having said that, we can dig in with multiple examples. Now, today in the COVID era, we see that how the North people who have originated from Northeast, the original residents of Northeast, how they are being racially abused. There have been incidents in New Delhi, a man spitting betel juice on a Northeastern girl while she was crossing the road and calling her coronavirus. A group of Manipur boys and girls who happens to be students in Delhi in one of the colleges, they go to a shopping mall, but the guard doesn't allow them to enter, and they drive them out because they look like Chinese. And when the guard is later arrested and asked that why didn't you allow them to enter, they said I was afraid that they are Chinese and they must bear coronavirus. Same thing happened in Mumbai. Apart from this, apart from racial hierarchies, so now the question is, this racial kind of abuses that are taking place in at the time of COVID-19, is it new? Obviously not. At least as far as I remember from my childhood days, when I started, since the time I've started understanding about these problems and challenges, I clearly remember that how Northeastern students are openly abused even to date as chinkies out in the public open. It has become such a normalized term that it also, to be very honest, and I feel very ashamed to confess this point, that for a long period of time, I was not aware of the fact that this term chinky is an abuse. It has been so normally ingrained within our psyche. Similar way, communal hierarchies. I have already mentioned briefly about what happened the post Nizamuddin Markaz incident. Now, talking about this particular, communal hierarchies that we see, within Hinduism, we see the caste hierarchies, caste and subcaste hierarchies. With respect to the Hindu-Muslim clash, we see that how, different religious groups are trying to dehumanize and demean each other. We see in the process. That is very clear. So is it new? Obviously not. Since the time of the British colonial era, we see that how, with respect to colonization and later on how this communalization took place between the Hindus and the Muslims with, country-wide divisions, border disputes, etc., and it still continues. And throwing mud at each other, abusing each other, dehumanizing each other's religious and communal values continues even today. So COVID-19 is consistently pointing and is saying that, you see, what I'm trying to point out is it is nothing new. Nothing was normal in the time of pre-COVID era as well. We see cultural hierarchies in terms of urban-rural culture, where certain traditional indigenous cultures are consistently on a daily basis, cultural practices are being underrepresented, are being identified as invaluable, are being identified as worthless, and they are demeaned on a consistent basis. And how Western cultures, Western traditions, Western lifestyles are being blindly mimicked. We keep on blindly mimicking it just to prove ourselves that we are modern, we are intelligent, we are advanced. But COVID-19 is again pointing out and saying, is it true? It is raising a question. Because we see now, with respect to even in medical sciences, yes, COVID-19 antidote is being manufactured. It's getting, taking place across the world. But we can't deny the fact, if we do a comparative study between the infection rate between indigenous communities and the non-indigenous communities, we see that indigenous communities are very, very less affected, because they have their own medical remedies, which they have learned from their forefathers and foremothers, and they have, adopted from their ancestors. But unfortunately, in spite of being so-called so scientific, so-called being modern, so advanced, so intelligent, we are unable to do that. And then comes the geographical hierarchies. COVID-19 is being used not only in India, across the world, to show that how certain geographical places belonging to people belonging to certain geographical places are actually in a better state as compared to other places. And it is totally underlined with capitalistic intentions, just to prove that how the city culture, city people, they are more advanced in thought as compared to the people who doesn't stay in the city. But COVID-19 once again is exposing these kind of false narratives. And we can see that the people, a lot of places across the world where rural people are having more recovery rate than the urban people in many places across the world. So are what we see the medical hierarchies. There is a high percentage, if we compare the deaths of the white people with the black people, we see that black people are dying more than the white people. And the false narrative that is being manufactured is that usual Aryan race theory that white people are more strong than the black people, which is again false, because if we dig into the real story, the kind of treatment, the kind of attention that the white people are getting is much, much higher than the black people. The black people are consistently facing ignorance. And simply, if we take example of one particular nation, that is the United States, we can clearly see what is happening there. And then we have the educational hierarchies for sure, which is again getting exposed through this digital divide. Now, can we say that this digital divide is a problem of the COVID-19 era? Obviously not. We know who gets the digital privileges and who are deliberately digitally underprivileged. We are very clear of that. We can take the simple example of India. Only these things that already existed as normal, these negative elements, these challenging elements that till date was hiding itself under the pall of normality, is now getting exposed. That blanket is getting removed and the truth is coming out. So again, the question is, was anything normal in the pre-COVID era? Now, coming to the last part of my reflection, with which basically I will end my set of reflections. So now we have seen that what we have been talking about being normal to date is highly questionable, is highly problematic. Having said that, then let us do one thing. If the question, the elements of normal is so problematic, I'm really afraid to say what is going to be the new normality all about. And we can already see the financial experts are already predicting with proper statistics that what is going to happen after a year or two, when the impact of hopefully when the impact of COVID-19 lessens, what economic condition the world is going to face. Till now, leaving aside the world thing, till now, even in India, even within my friend circle, I'm keeping my statistics aside, even within my friend circle and family circle, sadly, I know many of them who have lost their job and are unable to get a job. So these personal experiences already make us question this very notion of normality. So what is important is, instead of running after normality, let us strive to create something which is abnormal. Because this normality is highly questionable. This normality is extremely hegemonic. It's extremely hierarchical. It is violent. It silences voices and creates divisions and rifts amongst individuals and communities in our habitual existence. So if we need to try to come out of this normality, what is important for us is to embrace a form of abnormality. And how it is possible, or I want to say that I'm not going to preach a doctrine here and give you, okay, these are the 4 points, drink it with water like capsules and you are abnormal. No, I'm not saying that. What I mean is, what could be the possible abnormal ways of existence? The first is resilience. We need to understand that these loopholes that already existed within our respective social structures are only widening and getting more and more exposed. It is high time to come out of that utopic normal perspective and unsettle ourselves and be a part of this reality. Face the reality, face the heat. That should come through resilience. Then only we can recover. We can resist. We can create an abnormal world which is more open-ended, which is more inclusive, which is more pluriversal, and at the same time, which is more co-creative, which I talk about or propose through this collaborative existence. When even just through social networking sites, I have seen many of my friends cherishing the point that it is because of this COVID-19 lockdown that I could meet my family members after 5 years. I don't remember for when the last time I spoke to my grandfather, my grandmother sitting together in the sitting room. Obviously, these kind of experiences come from a privileged position. These kind of experiences come only to those people who are lucky enough, who are privileged enough to have a family and they don't have to think about what they are going to eat, where they are going to stay. I completely admit. But also, I can't, and also, I don't say that COVID-19 has done a great work. I'm also not acknowledging this. But what I mean to say that some lights of positivity can be seen at the end of this dark tunnel of COVID-19. And that is collaborative existence. People coming together, people talking to each other. Today, we live in such a world where people sitting in a drawing room and a bedroom, they contact or connect to each other over WhatsApp and, WhatsApp chat or through smileys. That is what happens in reality. So now with this lockdown, people are realizing those lost, cherishing cultures that they used to have once upon a point of time prior to this technological toxins that have infected us. The third thing is solidarity. This COVID-19 has once again proved that being a rich, being a poor, being a middle class, high class, staying inside an AC room or staying out open in the sky doesn't really save you from being infected by COVID-19. Anybody and everybody can get infected with this particular pandemic. So if I look at this pandemic beyond a disease, I see it's as a massive tool of exposing a lot of our bad faiths that we live with. It is kind of shattering a lot of bad faiths that we have been living with till date. So it is kind of consciously or unconsciously creating a bridge of solidarity where we come out to help each other, irrespective of whatever is our economic position, cultural position, social position, caste, class, race, gender, community, etc. Creating, different constructing bridges of solidarity. And if we are able to do it consistently in the post-COVID world, then only there comes the chances of resurrection. Obviously, resurrection again doesn't mean that, okay, then everything will be normal. No, we don't want everything to be normal. We should not look for normality because normality has been problematic. These problems of normality, that is what COVID-19 is consistently reminding us, that till date, we all have been, blinded by the suffocating notions of bad faith. We were living in a world of absolute illusion. All those worlds of illusionary existence have been shattered by this COVID-19, and it is consistently reminding us that we can't live in this so-called normal world. We have to create abnormality, chains of abnormality, and that is only possible through resilience, collaborative existence, solidarity, and then only resurrection is possible. And if we still fail to understand this, it can be seen already how attitude of the people are positively changing towards each other because of this crisis. But in some places where we see that we still fail to understand this, then obviously bigger pandemics are waiting for us in the near future. Because this pandemic is not just a medical crisis. It is also a racial pandemic, a cultural pandemic, a political pandemic, an economic pandemic, and several other forms of pandemical elements are getting exposed through this particular medical crisis. So here, with respect to this, I come to the end of my reflections. Thank you so much.
Presentation and really, really a thought-provoking point that how to deal with the post-COVID era and what is normalcy, what is new normalcy, what is new normalcy, because sometimes we are very, very confused with the words and we always try to boost uh, our write-up, our dialogue with some very extra juvenile words. that is not the point. The point is, as you rightly pointed out, that how to deal with this in a very layman understanding, because always we believe that we are in a very privileged part, and we are very happy that we are privileged. But how about who actually doesn't have anything? How to deal with them? Are we really, with this dialogue sharing, with this web platform for dialogue, series of webinars, have been quite enough to feed them, to provide them the basic amenities, the basic necessities, and the basic rights? But the point is, at least we are doing and thinking something, and this thought is very important. Thank you so much, Dr. Day, and with your lecture, I also came to know so many facts, and we have a wonderful feedback already from different participants, because this particular forum is having lots of participants from multi subjects, and they have questions already in the chat box. Dr. Anila Chandran, she would like to ask that, hi Shayan, Anila here. I believe instantly oblique madness is just a reflection of people who live according to the norms. Insanity gives a kind of freedom to leave our thought. What do you say?
Absolutely. Absolutely. In fact, I tell you one interesting point. I'll just connect briefly with one of my. Today in the morning, I actually had a lecture, and where I talked about the question of pedagogy of the stupid. And in that particular, reflection, set of reflections, what I talked about is that we are often told that, oh, if you cannot think in a particular direction, if you are not thinking in a particular light which the society wishes to impose on you, immediately you are said, oh, you are mad. Or if you are not understood by somebody, oh, you are so stupid, you are asking silly things, you are putting in silly thoughts. So I kind of relate this point in this here as well. And as Anila has asked, that insanity and madness is just a reflection of the people who live according to the norms. Absolutely, yes. I mean, if I am, for instance, if somebody calls me stupid, I acknowledge that. Yes, I'm happy to be stupid. Because why? Because stupidity, I'm happy to be mad. Why? Because being mad has enabled me to realize that I have the right to think in my own way. Being mad has enabled me to realize that I don't have to stand in a one size fits all shoe case. Being mad has enabled me to realize that I can think, I can act, and I can work in my own way. So obviously, this element of insanity is highly acknowledgeable. And as you say, it obviously gives us a self-created liberal space to live our thoughts, because I will specifically say self-created liberal space, because often freedom is also imposed upon us. Freedom can also come as an imposition upon us. When we are bound to be free, that is also a problem for us. I have the freedom of being free and not to be free at the same time. But that is my authority. I will decide. So yes, Anila, you are absolutely right.
So much, Dr. Day, for your wonderful discussion, because it's more of a new normalcy, or whatever new things is happening. Sometimes we believe that who are being into the madness or who are insanity, they are not normal, but according to them, they are very much normal. It depends which side we are actually. So in this particular COVID era, it's a COVID era actually, it's not 2020, rather COVID era. Which side we are? Are we in a side of the poor or the disadvantaged group? And this in West Bengal also, we are having 2 days a weekly lockdown. 2 days weekly lockdown means a surprise lockdown. Means if this week lockdown will be in Thursday and Saturday, next week it will be surprise for the COVID or coronavirus, that any day will be lockdown. And we are very happy because we are privileged. We are sitting at home and we are doing work from home. That's wonderful for us. But what about the rest of the people who have to go out for their daily earnings? And we are thinking that this kind of lockdown and surprise lockdown would be the solution. I'm not taking the opportunity to say more about it, but I have a one very observation from Anjali Chahal and also Dr. Chandra Upadhyay from Nepal. Dr. Chandra would like to say that can you please tell something on collaboration during COVID?
Yes, so thank you for this question. Uh, this collaboration during COVID-19, uh, as Dr. Upadhyay also mentions in the chat box, that I
Yes.
mean the collaboration between the government authorities, private sector, and the community. See, the point is this collaboration actually comes from this position where we realize that the false perspectives of existence that we all live with. And that is what I have been talking about, being normal, being abnormal. My notion of normality has to be different from somebody else. But just imagine what we used to do in the pre COVID era. Our intention used to be that we will filter certain narratives that satisfies our psyche, and then we will generalize it as that, you see, this is the normal. Anything existing outside is not normal, not to be existed or accepted as normal. Now with private sectors, it doesn't require to be said that basically these private sectors, obviously the central intention behind the existence of the private sector is to money making intentions, profit making intentions. Whether they indulge in social activities, whether they end up opening up NGOs, at the end of the day, we see that money making is the sole intention of these private sectors. But also at the same time, this COVID 19, with respect to several joblessness, with respect to the financial losses these private sectors are facing today, it clearly entails the fact that money making, filling up the coffers in the bank, doesn't make one happy or satisfied or doesn't make one powerful in the world. We see what is happening with the aviation sector. We see what is happening with the various engineering companies. So now, in fact, in India itself, many private sectors who used to exist individually are joining hands with other private sectors and government authorities to create collaborations, to build up a strong single sector, so that in the midst of this crisis, they can all survive together. The story was never the same in the pre COVID era. No one really cared who fell and who rose. One cared only for the self. But now you see, COVID 19 has put the situation in such a tremendous crisis that people have to come up with these innovative ideas of collaborations and co creations. So, since your question was in this direction of government authorities, private sector, and the community, so that's why I came up with this example. And examples can be ample with respect to education, examples can be ample with respect to cultural existences, where we all culturally acknowledge each other's differences, join hands together to help each other, whether it is financially, whether it is emotionally, whether it is physically, in whatever ways it's possible. We share with each other whatever things we have, whatever valuabilities we have, so that we can all exist with each other.
So much, Dr. Dey. We have another question from Anjali Chahal. Can you elaborate the sense of shifting discourse of emotions which are private for most of us, but has become public through the shadows of solidarity scene? Wonderful question.
That's a fantastic question, Anjali. And I don't know if I really have a concrete answer to this question, because shifting discourses of emotions through this doorways of public city, this public and this private element, is also very problematic for me for various ways. Now, how do we define this notion of being public and being private? It is underlined with toxic masculine elements. For instance, uh, you might say that, we have a very common saying that men don't cry in the public, only women cry in the public. But today, in the time of COVID-19, I am really doubtful how many people are sticking to this ideology. Number two, there are certain emotions and the elements, there are certain aspects that exist in our daily life, which is both private and public at the same time. Maybe in the pre-COVID era, there are certain emotional expressions that we only thought to be private. But today, during this COVID era, what is really happening is we have to express ourselves openly. We see people coming in front of the camera and expressing their concerns. People crying in front of the camera because they don't have proper medical facilities, they don't have proper food, they don't have the basic things. We see every day what is happening in the hospital. Dead bodies, unclaimed dead bodies, or people getting infected with COVID-19, they are not being treated. So, certain emotional elements which used to be private at one point of time are no more private at all, because what we can understand through these emotional expressions, that it is not just my problem, it is not a his problem or a her problem, it is becoming everybody's problem. Today, what is happening with a person of infecting and dying with COVID-19, which I can see in the photograph, it can easily happen with me as well, no matter wherever I sit, no matter how much money I earn, no matter how much physically or emotionally I am strong. It doesn't really matter. So I believe, coming back to your question, that this sense of shifting discourses of emotions, which are private for most of us, has become public through the shadows of solidarity. It has to happen, and it will happen in the coming days more and more, because COVID-19, as I said, it is a set of exposures. It is also exposing our emotional crisis as well. It is also exposing that my sadness is not just my sadness, it is somebody else's sadness as well. Again, that question of, collaborative grief. Again, that question of understanding the collective crisis.
Wonderful. Anjali also said that agreed. Thank you, Shan, for this response. Okay, so Dr. Chandra Upadhyay, he's also telling that thank you so much, Dr. Dey. Sometimes I observe stakeholders blaming each other and issues become conflicting rather than collaborative. Yes, absolutely right, sir. So
Absolutely right.
we are almost at the end of the discussions. I would really love to have some concluding remarks that how to deal with this kind of emotional traits that we are going through with this COVID-19. And I really want to end up with a positive note from you, sir.
Yes, absolutely. And I think one important thing among several important things, one important thing that I believe is this, that positivity, this element and feeling of positivity, comes from a lot of negative experiences. Because obviously we cherish the sun rays in the morning because we also experience the darkness of the night. It's as simple as that. So now, today, we stand in such a scenario where not a single person can claim that I have not been infected with COVID-19. Now, what do I mean by that? Obviously, I have not been infected. I'm not talking about the physical infection. Today, even sitting in Bhutan, if I talk about my own experience, today, even sitting in Bhutan, where I have no tension of losing job, frankly speaking. I have no tension so far of getting infected with COVID-19. Things are being very well managed here, very well taken care of. Still, I spend sleepless nights. Why? Because when I think of my friend who has lost a job, how is he or she running the family? When I think of my old parents who are staying in Kolkata, and if anything happens, God forbid nothing happens, but practically speaking, if anything happens, I cannot do anything. I cannot even go right now. So you see what is happening right now. Maybe even a year back, I would have not given so much of thought. But COVID-19 consistently ringing a bell in my mind and saying that, listen, Sayan, this is not just a problem who is getting infected. You are also infected. It is your problem as well. So what is happening altogether is I am able to share the collective crisis, the collective sadness, the collective repentations to a certain extent. Obviously, I am not able to do it holistically, to a certain extent vastly. Now, out of this negative experience, I see a lot of positive light because I am being forced to be in such a position where I have sympathy, I have love, I have care towards each other. Where when I wake in the morning, I don't only pray for my own self or my mother and father, I pray for several other selves, several mothers, and several fathers in the world. And I think this is going to only expand more and more. So these negative elements that we are facing today is bound to generate collective and collaborative positivities in the near future.
Thank you so much, and wonderful explanation. And I'm really happy that we finally able to talk each other in this particular pandemic. We know each other with this pandemic because previously I didn't know you. So I think that's a positive chances that COVID-19 is actually providing us the opportunity to unwrap ourselves and unwrap our thinking process with lots of unknown things and lots of unknown. I think unknown thing is the most darkened side of our mind, and that's why we are afraid of. So that's the main thing. And I really want to have Dr. Aniruddha Burman to share some of your thought for particular session. So we can't hear you. Sir, we can't hear you. I think there is an audio problem from your end. Yes. So I think COVID-19 is giving us the opportunity to unwrap our thinking process and in a new thinking. So yes, sir.
I'm just
Yes, audible.
audible.
Yeah.
Okay, good. It's such a wonderful presentation. The problem with us is we think we know. I think that's our problem. Whereas that knowing percentage is maybe 1% or a little more. And as Dr. Swati has already mentioned, problem is on which side of the fence you are. Because we normally treat some people as abnormal because they are in the minority and we are in the majority. Now, if they were in the majority, what they would have thought about us? That's a huge problem with us, actually.
Exactly.
So, much earlier, actually, one of the programs here, webinars here in this platform, we have also discussed earlier. I remember once we did a course with the CCRT, the Center for Cultural Resource Training, and we said, like, when we used to talk of coming to the mainstream, now what's the mainstream like? So mainstream is because I happen to be in the majority. So we are not thinking of the federal structure. So even here, but there are people in the minority, maybe, apparently, but maybe they know more. So if we keep this open, as you have rightly said, if we keep our mind open, then maybe of course we can really go ahead. We can really help each other. And now that most of us are thinking, there is a very good step that we are thinking, whatever kind of way is not us, is us all around together, taking everybody around, then only possibly we can go ahead. Thank you, Dr. Dev, for a wonderful presentation. Wonderful. And thanks to Dr. Swati once again. Yes.
Thank you so much, sir. Thank you. Thank you. It's really wonderful to hear you, and maybe in future also we have a collaboration, and in a true collaboration, not in a just a pen and paper. In a true collaboration, we will definitely do something, very effectively and very constructively. Dr. Day, it's my heartfelt gratitude to you on behalf of a platform for dialogue, and have a wonderful night and have a wonderful stay, and all of you please stay safe, because it's really hard time, and infection is going very high range, so we really
And
really worried.
And also, thank you so much for Professor Barman for this very interesting point about this mainstreaming. Yes, mainstreaming has always been an issue, and bringing this also point towards the towards the concluding part of these set of reflections is very impactful. And I extend my sincere thankfulness and gratitude to Dr. Swati for inviting me and giving me a space to share my reflections, my questions, my thoughts with all of you. And also, thank you so much for all those wonderful questions, reflections, and the points that brought to the forefront. Thanks a lot once again, and I wish safety to all of you.
Thank you so much. Thank you. Have a nice time. Bye bye.
Bye. Thank you.